Good afternoon, everyone, and welcome to your MedGroup's weekly town hall. I am Gwendolyn Foster, the MedGroup commander, and with me I have Captain Aaron Lankert, our public health officer, as well as Major Christopher Bates, who is our bio officer. So today we're going to give you an update on the situation, as well as where we are as your MedGroup with our services, and then all the things that we're doing to flatten the curve. So with that, first slide. All right, Captain Lankert, I'm going to let you speak to this.
Awesome. Good afternoon, everybody. So this is basically a site picture of the United States, as well as California in the bottom right corner. So right now, things to note are which states are kind of showing more COVID spread, more COVID activity, and that's all going to be on the left. Basically, there's widespread transmission pretty much over most places in the United States, which is reflective of what everybody's reading in the news, seeing on TV, all that good stuff. So for California, we are doing well. The cases continue to go up, but we're not getting hit as hard as other parts of the nation, that's for sure. And then as well as the numbers around the Edwards community, we still haven't seen a massive amount of impact from COVID-19, which is good because we're still in those preparatory steps. That means we still have time before it does hit us, if it hits us, to still do some good interventions. We're not going to be as reactionary as potentially the rest of the country, or even places like LA or New York City is a great example as well. So that's pretty much your overall site picture. Next slide. So this is a graph that kind of shows LA, which is one of our subset populations. It shows, I believe, Kern County, and then Lancaster, if I can read it correctly. Yeah, sorry, it's a little tiny. So anyways, this shows that basically our rates. So you can kind of see on the lines there, this is going to be our rate per 100,000 people in each of those populations. So it's a good way to kind of compare, because if you look at the graphs there, or the actual bar charts, you can see LA has a tremendous amount more cases than our local area does, which is to be expected because the city center has literally millions of people in it versus a place like Lancaster, which has not nearly that many. But that's basically what we look at for that, is going to be with the trend line. So you can see we're all pretty much going up at a similar rate, which is to be expected due to our populations being so close. And Bakersfield's also had an increase in transmission recently as well. So they're starting to boost those Kern County numbers as well. Before I leave this slide, though, I just want to kind of go over, when we say flatten the curve, the reason why we say that isn't really have much to do with stuff that's going on now. It's looking at the overall peak of the outbreak. So you'll hear people say, oh, we're going to peak over the next couple weeks or whatnot. A lot of those are really projections and predicting how the disease is going to be modeled. So when we say flatten the curve, if you have any given disease, what happens is you reach a peak where the most amount of people get sick. Usually it's all at one time if there's not an intervention. So the peak's super high and super sharp. What we want to do to flatten that is we recognize that people will be getting sick from, in this case, COVID. So people will be getting sick. It's just delaying and reducing how many get sick at any given time. And we do that through social distancing and other interventions. And that way, the burden of people that are sick does not overwhelm our healthcare system. So it makes the overall outbreak more manageable. So we know people are going to get sick. There's no way to make anybody flat out not get sick, or else we wouldn't have an outbreak curve. But by doing the social distancing steps, by taking some of the other steps you'll hear about in this town hall, that's how we can flatten it. So we smush it down so it's not an immediate peak that just basically overwhelms the healthcare system, which is why social distancing is so important right now. Because if we keep people away, we stop the transmission, or at least we slow the transmission, and that way new cases don't overburden the system.
Thank you, Captain Lankert. And so as you heard her talk about flattening the curve, the new guidance did come out as far as cloth masks. So if you see us, what's around our neck is our mask if we were not within that 6 foot distancing, social distancing. And to lead us in talking more about masks is Major Bates. Major Bates?
Thank you, ma'am. Good afternoon, everyone. I'm Chris Bates. I'm the bioengineer for the base, and what I want to discuss on the next slide is going to discuss the differences between the cloth mask, the surgical mask, and the N95 mask. And so the important part here is that the masks do not substitute for good hand washing, good hand hygiene, as well as social distancing. And another point that's important to make on this is, you'll see on the slide, it talks about the N95 protecting from small particulates coming into the mask, versus the surgical mask and the cloth mask do not. The intent with those two is to prevent your germs from escaping that mask. And so that's a misconception that is out there, so I want to make sure that that's clear to everyone. And so the intent with wearing the N95 is for medical providers doing medical procedures, versus the surgical mask keeps the germs in, whether it's the provider wearing it or whether it's the patient wearing it. And so there is recent guidance from the Secretary of Defense, as was recently published by our leadership here, that talks about wearing cloth masks in public areas. And again, you'll see at the commissary and the BX it is now required in order to go into there. So again, the intent is that we don't spread the germs, and we're trying to flatten that curve through proper techniques and hand hygiene, social distancing.
Right. Thank you, Major Bates. Next slide. So again, this is our slide as far as our services. We are still in HPCon Charlie, so our services has not changed. As you've heard me say before, they are degraded. All you have to do, though, is call the appointment line, and whatever service you are trying to reach, we will make sure that you get it at the right time at the right place, whether that's virtual or that is with our acute curbside service. Next slide. And this is just some of pictures of how we are flattening curve at your med group. So we have our ECP point, our entry control point. So every single person that is coming up to our facility is screened. And yesterday was Wednesday. So for our retirees, that is the process to your right that shows that we are making sure that we continue to flatten the curve, keeping them safe and keeping us safe as well. Next slide. All right, so with flattening curve, continue to do what you're doing. As you heard Captain Lenker say earlier, that our community is doing well compared to the United States, and Edwards is doing even better. So continue that social distancing, continue to cover your cough, wash your hands, wear your cloth mask if you're unable to keep that social distancing, and that will continue to have an impact on that curve. We are also working very close with our community health partners, and they are remaining steady. They keep us abreast of anything that's going on in their area because they know that will have an impact on us as well. So that is all for our slides. Next slide, the last one. I forgot that one. So this is that self-checker, so don't forget that. When you're unsure, you have questions about what you should do as far as seeking that appropriate medical care, you can go right to that CDC site, and that will help you determine what you need to do versus staying home or versus you actually need to be seen. Now, one more slide. So thank you again for turning in, and we want to turn it over to your questions because we want to be able to provide you the information that you need. Chief.
Okay, earlier in the week we got a few questions on our Facebook page. The first one was, will the lab be offering immunity tests for COVID-19? The answer that our lab gave us is that our reference labs currently do not test for immunity antibodies, nor do we test in-house. There are some companies coming out with rapid testing, but those are new to the market and they have yet to be FDA approved. So for the time being, we will not run anything in-house that is not FDA approved. We are still holding on that.
And Chief, I just want to pile on a little bit. So when it comes to that testing, we continue to work hard to increase the number of test kits that we actually have available, as well as we are still pursuing that in-house capability. We have basically we've been cleared hot to be able to purchase that, but we have to work with our local vendors to be able to bring that in-house. So as we continue to pursue that, once we have that, we will make sure that everyone is aware.
All right. The next question we had received regarded the base going into Delta. And I would like to tell everybody that in this forum on Thursdays, we have our medical town hall. So we will defer any questions that aren't medical related to Colonel Heiger's town hall tomorrow. Every Friday he holds his town hall, and some of those questions will be answered at that time. So we will focus again on our medical questions here. So for those of you who asked questions about the commissary, that will also be answered tomorrow at the base town hall.
And I do want to just pile on a little bit with the commissary. So everything that's going on in this installation, because our adversary is a disease, medical is heavily involved with all our base organization. So with public health and bio especially, they go out to our other partners to make sure that we are all adhering to the guidelines that have been given.
All right, so we have a question coming in on Facebook. One is, where can we get these slides? Apparently there's one on edwardsaf.mil that is older, from the 31st of March. What we do as a medical group is we post question FAQ, so the questions and answers. We post those on our Med Group Facebook page. So if you like us on there, that will be available. Some of the slides you saw earlier on the screen, they change hourly.
Yep.
So those we haven't been posting, but we can post things like the CDC guidelines. If you go to cdc.gov, you will find all that information on the proper wear of cloth face covers and when you social distancing guidelines, things like that. So on to the next question, talking about face masks. So will the cloth mask help protect you if it has a filter?
Major Bates.
So the cloth mask is not designed to protect you from particulates. It's not to say that it won't block out anything, but it's not intended to protect you from viruses, which is small particulates. And so if you do put a filtration device on there, it's not recommended because it's not NIOSH approved, which is who certifies respirators such as the N95 and other respirators that we use enterprise-wide. So I would say that it might protect you from something, but I would not suspect that it would protect you from the virus because of small particulates.
Okay, thank you, Major Bates. We have a question about hand sanitizer. If you run out, is there anything else that's approved for use? One example being straight alcohol.
So that's a pretty good question. Yeah, so hand sanitizer, well, first of all, the primary thing you should be doing is washing your hands, because there's a little bit of a misconception because people think that hand sanitizer just kills everything on there. It's the 99.9% of germs, which is true. However, hand sanitizer does not remove actual particles on your hands. So if you have something that's on there that's like something gross that's basically the source of the bacteria, just using hand sanitizer just smushes that around and it keeps basically infecting your hands. So if you don't have access to hand sanitizer, soap and water, which is ideal again, and you're like in your car or you're out and about, or it's just not feasible, or someone that needs to wash their hands just can't, like smaller children or something like that. Hand sanitizer that's 60% alcohol or greater is ideal. But before you really get to the point of what do I do after hand sanitizer, I'd still recommend you going back to just good old soap and water. I can't really comment on whether or not 100% alcohol or anything greater than that's not meant for that use would be ideal. Obviously, we want to use stuff that's meant to clean your hands. So normal hand sanitizer, or the CDC actually has recipes on the CDC website that's how to make at-home hand sanitizer. So I'd recommend doing that before kind of going to these super next steps. And then again, just to foot stomp, soap and water. That's really all you need. It's pretty basic, so which is lucky in this situation.
Thank you, Captain Lankard. Okay, another question. As a second order effect, will measures to flatten the curve help eradicate the flu?
That is an excellent question. So the reason why the flu cannot be completely eradicated each year is because it's really bad at replicating itself, hence why influenza, the vaccine has to change each year. So when it replicates inside basically cells, it doesn't do it well. So it messes up. So it's not the same each year, which is why we have seasonal flu. The same measures that we're using right now as far as social distancing, flattening the curve, that applies across all respiratory diseases and anything that's not what we consider a point source outbreak. So like a foodborne outbreak, that's a point source. We know where it came from. You're going to get sick as long as you're eating that bad food and it's over. So stuff that follows this type of model of a respiratory pattern where you have that nice like little slope, or if you don't flatten the curve, you have a giant peak where everybody's all sick at one time and it's pretty much over after that. So for stuff like the flu, for stuff like anything else, even the common cold, even though that's pretty hard to to conceptualize because that's made up of a lot of different viruses and stuff. But yeah, the same things we're doing now literally for COVID can absolutely apply to the flu. Whether or not it's able to eradicate it, that's kind of hard because the flu basically has year-round transmission, even though we have a season. But everything we're doing now 100% can apply to other respiratory community transmission diseases. So the lessons learned from COVID overall are really good steps to have throughout other diseases, other incidences, wearing, like even through the mask wear, a lot of things like that, washing your hands with soap and water, all that good stuff literally applies to these other situations as well. So it's really great practice to do all year round.
Thank you, ma'am. A question about testing. Will drive-through testing be available on base?
It really, as far as drive-through testing, as we increase our testing capability, and if we get to a point where we could test freely, as we're seeing in some of other communities that have that ability to, if we need to test, we can test everybody, then that would be how we would test. We do that curbside service for all our patients that are exhibiting any type of respiratory illness. So that is something, if we had the mass to be able to test everybody, that is how we would test.
Okay, another question from the same individual. This one we may have to defer to the base town hall tomorrow, but I'll go ahead and ask the question. How is it being verified that retirees and veterans coming on base Wednesdays have not been out of the local area in accordance with the new wing commander guidance?
I can say the retirees that are coming to the med group for their prescriptions, they are part of our beneficiary population, our empanelment. So they have already been basically vetted to be able to come into our facility. So I can't answer it from a medical perspective.
Thank you, ma'am. All right, this one's for Major Bates. Can you please outline the basics of mask wearing etiquette? Patrons and employees at the commissary may not be wearing their mask over their nose, maybe taking it on and off. Gaiters are slipping down, which is a concern for them and anything they're handling. How often should the masks be washed? Can you give us any advice on that, sir?
Sure, Chief. So the idea behind the mask, again, is to cover your nose and cover your mouth. And so if there is a nose piece that you can shape to your nose, that's going to give you a tighter fit and be able to keep more in. And so the better fit you get around your ears and around your nose and around your mouth, the more effective it's going to be in keeping that virus from spreading. And so as far as washing goes, there is no strict guideline that says this is exactly what you should do. It's all based on frequency of use. And so what that means is if you're going to go out into a place where you can't exercise social distancing, you should wear the cloth mask in order to keep your germs in. And as soon as you're done with that, the preferred method is to go ahead and launder that or replace that mask. If that's not feasible because you're in an environment that you can't wash it, at least daily is the recommendation per LA County.
Thank you, sir. A question about the virus being very new. Will the virus stay in your system after the isolation period? So if somebody's been out for 14 days of isolation, is there a chance it could still be in their system?
So right now, we currently follow the CDC's guidelines as far as releasing people from isolation, from quarantine. In this case, it'd be isolation because we're assuming someone's actually sick with COVID. They go through the 14 days. They're not necessarily released at the 14 days. So there's a couple of criteria they have to meet in order, by current guidance, which again is from the CDC, to deem them basically safe to go out and about with no or minimal risk of really infecting anybody else. It's basically the benchmark for when they're cleared to return back into the population or go to work or whatnot. And that's going to be, I believe it's a longer of either 3 days since their fever broke and their symptoms subsided. And then in addition to they having to be at home for about at least 7 days. So there's a couple, and that keeps changing too. The guidance keeps changing. But basically, right now, it's not necessarily if you're sick, after 14 days, you're good. It depends on where your symptoms are at. It depends on what the doctor's evaluation of you is. Are you still febrile? So do you still have a fever? Are you still coughing? There's a lot that goes into it. So it's not just like a hard and fast 14 days and now you're clear no matter what's really happening to you. Because you might not remember too, the incubation period is usually a max of 14 days, but you can get sick on day 13. You could end up starting to show symptoms. So that would obviously extend how long you would be kept away from people or kept in isolation and then returned afterwards. So, I mean, just in summary, it really depends on the situation, depends on the symptoms, it depends on what the course of disease looks like for any given individual. But then there's also a lag time after symptoms start getting better, where then the doctors will evaluate and be like, yeah, you're not showing the traditional signs anymore. You're not showing X, Y, or Z. And per the CDC guidelines, you can now be released. You're not considered a case anymore. You're considered recovered, essentially.
Thank you, ma'am. A question about, do we know how soon COVID was introduced into the community? I guess there's news reports saying that it may have been reported in California as early as December, people could have had it.
So that's a good question. So since essentially back in December-ish is when China started really identifying that it was going around the Wuhan province, which is why Wuhan was such a buzzword essentially at the time. So there are a few reports out there that are kind of looking into when did it actually hit the US, because remember, if we're not looking for it exactly, COVID really does present like a flu, it presents like a cough, it can present like the common cold, honestly, or just something super minor that I don't even consider myself sick because it's such minor symptoms. It's just like, oh, I just have like a little bit of a cough, it's no big deal. So there are thoughts that it could have gotten here earlier. Unfortunately, in any sort of outbreak that's like this, that is a global outbreak or global epidemic or pandemic, it's really hard to do that whole like pinpoint who was actual patient zero, and the whole concept of like who was the first person that actually came here is pretty hard to tease out no matter how good they are at contact tracing or connecting the dots essentially. So it very well could have been here earlier than what people were identified it as, but at the time it's because we didn't know what we were looking for. It didn't really hit the national scene. It wasn't really hitting the world news as much. And again, because of the symptoms, you can't confirm someone actually has COVID without testing for it. We're not testing for it. We weren't really tracking it at the time necessarily as a country and as the world. So it could have been here earlier. We don't know, and I don't know if there's any real good way for them to figure that in the future. I'm sure after the outbreak or after this whole situation's done, there's gonna be a lot of after action reports, a lot of health departments looking at back in time to say like, hey, what happened here? And we'll get a better idea of it. But I don't know if we'll ever actually for sure know precisely when it hit California versus other places.
Thank you. And then one of the pieces of that was about antibody testing to see if people are immune. And I know a few people kind of logged in late to this. So we'll just recap. Right now, there are no FDA approved test methods for those antibodies. So currently, we will not be doing that test locally. And we will follow it closely for any approved use of those tests. Okay, we have a question about taking care of sick children. If your child is sick, how would you take care of him or her and still keep your 6-foot distance all at once?
That is a great question. So unfortunately, in situations like that where you're taking care of a kid, you're taking care of somebody else that might not be able to take care of themselves or is really sick. And then, like, I know if I'm really sick, I want my spouse to help me out with a bunch of stuff. So a lot of it is down to what's reasonable. So if you're taking care of a kid, it's not like you're going to necessarily keep your kid across the room from you. You're absolutely going to already take care of them the same way you're always taking care of them. It's just no matter what, you're still in the same house with the kid. You're still taking direct care of them as you should as their parent. You're just going to be exposed to them. So it's kind of like an innate risk with the job of being a parent at this point. You want to still take as many precautions as you can. Try not to get coughed on directly or anything like that. Make sure if your child's old enough, make sure they're trying to cover their cough as much as possible. Follow the same guidelines that we're basically telling you to do when you go out into the local community, just with taking care of your child. Wash your hands very frequently. Make sure you're taking care of yourself too on top of it. Make sure you're wiping down everything. So even if you're taking care of a sick child, it's not necessarily a guarantee you're going to get sick. So you just want to minimize that and basically give yourself the best opportunity to not get sick, even though you might still, depending on what the situation is, what the kid is, how sick the child is, stuff like that. So you still want to take care of yourself, maintain the 6 feet deep distance when reasonable. But again, if you have to care for a small child who can't take care of themselves, that's one would assume that's the greater responsibility in that situation than maintaining that 6 foot distance.
Thank you, ma'am. I'm going to go back while we're waiting for some more questions to roll in. Please keep those coming. one of the questions about the mask wear was actually how to launder the mask. So a cloth mask, sir, do you have any guidelines for how you would wash those?
So there's no one shape fits all answer. My understanding is that most cloth masks are actually able to be laundered by a washing machine. That being said, if it does degrade the material, obviously you don't want to wear that one. You want to discard that one and get a different one. If machine washing does not work for the mask kind that you have a supply of, then you probably want to find a way to do it not by a washing machine.
Happy, sir. Thank you. Okay, right now we're kind of in a lull on the questions. Please keep those rolling in. Right now we do have the experts here. We have Captain Lankard, the public health officer. We have Major Bates, the bioenvironmental engineer. And we have Colonel Foster, the medical group commander. If there are any more questions on the line, please go ahead and send those. Here's a question for tomorrow's town hall. Just what time and where do I watch the commander's town hall? And that will be streamed on YouTube. And then it is planned for 1 o'clock, I believe. But we will get that information out to you for sure.
We will verify that, yes.
Here's a question about HPCon Delta, but unfortunately, that's a question that we would defer as it's not specifically medical. There are a lot of decisions, a lot of things that go into the decision that the wing commander would make when choosing to go into HPCon Delta.
Can talk a little bit from that medical perspective. So if when we were to go into HPCon Delta, that is something our installation commander, Colonel Heiger, would declare. He would be advised by our public health emergency officer what that situation would be that would cause us to go into that. It depends. It could be something that's going on right outside our gate, or it could be something that's going on right on the installation. And that is something, again, that our public health emergency officer, Lieutenant Colonel Westy, would be advising him. If when we were to go into that HPCon Delta from the med group, we would still be providing service, whatever that situation is. We would be all hands on deck providing that emergency services that would be needed. We would still be partnering with the Nurse Advice Line, so there would still be that conduit. If you needed care, something was going on, you would call that Nurse Advice Line, and we would actually have providers on call to partner with them so we could have that warm handoff, so you could still be being taken care of during HPCon Delta.
Thank you, ma'am. Okay, a question came in. A friend of mine has shown all the symptoms of coronavirus except a cough. Why would you be denied testing if most of the symptoms are present, especially being immunocompromised?
That's a good question. So it depends on where your friend, I believe it was a friend, where your friend is getting tested at. So depending on the organization, depending on where you're at, there's going to be different testing algorithms based on, like, if you're testing through the county, they have their own algorithm for whatever their own reasons are. So a lot of it comes down to how many test kits are available and what their scheme is as far as prioritization of those test kits. So back before we had a lot more, it was a lot more stringent. So it used to be, and again, this changes almost daily sometimes, depending on the evolving situation. So again, back when we had very, very few test kits, and I mean we as in the nation, they started to prioritize only people that were hospitalized, immunocompromised, or had a high risk thing, and they were like needed it to determine care. So first, that was the main priority. Before that, it was, did you have the travel history? Now that travel history is kind of out the window, we don't test people necessarily according to travel history. So it depends if you're getting tested on base. We have our own kind of algorithm. LA County has their own as well. It really depends on where you're getting tested at and how they're basically managing their supply of test kits. Depending on what your friend's provider says as well in any of these situations, they may or may not test depending on whether it would actually impact the care plan essentially for them. So there are situations where the provider determines, okay, well, yeah, we could test you. You probably have this. However, will that actually impact how I'm going to be treating this patient? Yes or no? And sometimes they go off of that as well. So it really depends on an individual situation. Regardless, that person should be getting the best care possible anyways for their symptoms, COVID or otherwise, and especially if they're a high risk population their doctor would be taking that into account as well. But as far as it comes down to say, yes, you have COVID, no, you have COVID, are we going to test? That's going to be up to either the provider discretion in conjunction with what the current testing algorithm is, wherever that person's at.
Thank you, ma'am. Question about clothing and mail, actually. Should we be changing our clothes after work before entering our homes and showering right away? And then should we be disinfecting our packages and mail?
I'll give you the packaging and mail.
Yes, ma'am. So again, there's no straightforward criteria that says yes one way or the other. Again, the important thing is if you are going to handle mail or anything coming from an outside organization that you don't know where it came from, the important thing is that you wash your hands effectively. If you think that the package might have come from an area that could potentially be contaminated, you want to consider maybe keeping it outside or throwing it away rather than keeping it around your children or any kind of high-risk population. As far as changing clothes before you go in, again, that's not necessarily a required thing, but it is an above and beyond precaution if you want to take that route. It probably does reduce the number of germs, COVID or otherwise, as Captain Lankard mentioned. But again, the most important thing is that you're exercising the social distancing and cloth mask wear if you're going to be out when social distancing isn't possible, and then the washing of hands.
Thank you, sir. All right, going back to the town hall question for the base commanders town hall tomorrow. It is indeed at 1 o'clock and will be on YouTube. You can look at the base's Facebook page. They will announce that as well and provide a link. All right, what recommendations would you give for a family with a deployed spouse returning when there is a toddler at an elevated risk for illness with a history of breathing problems?
All right, I'll answer that one. So good question. So everybody returning from overseas right now is on an automatic 14-day quarantine. So there are some things to consider with that, however. So if you are coming back and you're quarantined and that member is not sick yet, that's what quarantine means basically, is you've potentially had an exposure, don't know if you're going to get the disease, don't know if you're going to not get the disease, but it's basically to put you in a holding pattern until we know after that 14 days, yeah, you're sick, or no, you're not, you're cool. It was all just kind of a minor inconvenience, but it's good for the rest of the population because in case you do get sick, you're at one place already. That being said, in that type of situation, we would recommend that if you have someone high risk at home, rather than necessarily, and this is going to be up to the individual, rather than necessarily quarantining at home, you could consider to have that person quarantine away from those people that are high risk, because again, there might not be any threat right then for it. What we're concerned about is if that person starts to exhibit symptoms around people that are at high risk, essentially. So someone that had like breathing difficulties. Again, I'd also recommend consulting with your doctor though, because we can't really speak to specific situations as far as what the actual risk is for the child, for the parents, as far as what their medical conditions are. But generally, it is a consideration to either have the person that is high risk out of the home or have the person that's coming back that would need to be quarantined out of the home as well. And I know right now the base is looking into different plans to help assist with that. But in the meantime, that would kind of be my recommendation, is to have them potentially either separate in the home, so have the deployed member coming back either be in a separate room and they stay in that separate room and they do not come use any sort of common areas, have no interaction with basically anybody else in the family, and they're basically locked down into the room until that period's over, or potentially having them stay at a different residence, or some combination thereof.
Thank you, ma'am. All right. Question coming in saying that it looks like the state of Washington has definitely decreased from some of the higher risk areas. Asking if they're dropping down in their reported numbers, is there anything we can conclude from that for those of us here?
Another good question. I know I say that a lot. So this kind of comes back to when people are talking about we're going to peak at a certain time or like looking at trends. So on one hand, yes, since Washington was a higher risk area and had high transmission before a lot of other places in the U.S., you can kind of look at that as a cool, we might be going on that trend. But at the same time, there is a caveat. So this is a living organism. It is a living situation. So it's not necessarily a guarantee, because It all comes down to how well are we applying those social distancing measures, those things to flatten the curve. How well are we applying them, and how well are they applying them? If we see that and then suddenly are like, well, we don't really have to social distance as much, we're not going to follow their path. We're not. So as long as we continue to maintain the same strict, hey, don't go to work when you're sick, stay home, national quarantine type situation, we could easily start to see a similar situation happen here, because that's what we're waiting for. Is we're currently waiting to see, are we going to hit our peak essentially, and then where are we going from there? But at the same time, the warning is that just because we hit a peak doesn't mean we're going to come down right away if people don't continue applying those same standards, following the same directions, because a possible fear of what's going to maybe happen if people don't do that is that once we start getting relaxed on those standards, it's not going to necessarily let us go back down as fast as we could. So that's the foot stomp, that to get in a situation like Washington, if Washington truly is on the downward trend, which would be excellent, the way we can help to ensure that we also follow that same trend is to foot stomp the social distancing, foot stomp the hand hygiene, taking stringent precautions to try and prevent disease transmission and putting yourself in a position where you might be transmitting disease. So as long as those are applied, we could definitely continue following Washington's model a lot sooner if that's indeed what's happening there.
Thank you. Okay, a question regarding medical care. So say somebody has another condition. The situation used here was kidney stones. Because of the COVID crisis, if they start feeling like they're symptomatic for kidney stones, can they still be seen? What's the process to still get treated, especially now that our clinic operations have reduced?
That is a good question, borrowing from you, Captain Lankert. So yes, you can still be seen. So with calling our appointment line, first the nurses are screening the call, getting all your medical information. A TCON is put in. If it's something that can't be done as a virtual appointment, then you are going to be made an appointment to have a face-to-face with one of our providers. And we're going to make sure that we're following the proper precautions to keep you safe as well as us safe in providing that care. And if you needed care that was outside of our walls, we would still be putting those same referrals in, and our community partners are doing the same thing to keep you safe. And if care is needed, they are going to do that face-to-face as well.
Thank you. All right, for possible COVID cases where testing wasn't prioritized but symptoms are still being shown, are those being counted in our overall numbers?
Yes. The short answer is yes. So there's two different criteria we look at. One, we look at are you a confirmed case, which confirmed case means that you were tested, we got the results back, yeah, you're positive. Since we can't test as much, and this is the similar stuff the county used to be doing essentially before they kind of opened theirs up a little bit more and had more access to kits and some other stuff. But if a doctor deems you to be a possible, basically you become like a suspected COVID case is what they basically criterize you as. If that's the case, we still go through the same procedure we do rather if you're confirmed or not. So we treat the person as they're a confirmed COVID case basically until proven otherwise. And if they're never tested, cool, then we treat them as a COVID case. The only difference in that means that at the end we consider them closed rather than recovered because we couldn't prove they actually had COVID. But whether or not you have the test, if a provider deems this person as, hey, yeah, I think this person, no joke, might have COVID, but they don't meet the criteria for testing, there's literally no difference between what my office's policies are as far as what we do for that person versus someone that's confirmed. Because as a reminder, the COVID test takes a minute to come back. So we're still treating even the people we test. We're doing all the contact tracing. We're doing everything that follows that whole process even up before the test even comes back. So it's not like we're waiting for them to even get confirmed. We do it immediately, and we do it basically as soon as possible. So again, that applies whether or not they were truly tested or we're presuming them to be a positive. And they are counted in a lot of our numbers, but we also tease out confirmed versus suspected cases.
Thank you. We had a question pop up, and I actually have the answer for this. Is the base going to do any deep clean of a facility before people return to their buildings if there was a reported case? And that is, if there's a reported case in your area, there will be a deep cleaning performed, and then cleaning staff overall has increased their level and frequency of each cleaning. But if there's any more to add to what goes into a cleaning, we can expand on that. But currently it's general sanitization procedures, just done very thoroughly.
And you heard her say earlier, public health and bio are well engaged in all those areas. They make site visits to make sure what procedures are being done are appropriate in providing that safeguard.
All right, Colonel Foster, this is a good question for you. What is the method of notifying the community when health protection condition Delta goes into effect?
Good question, Chief. So that would be on our Med Group Facebook page, but the main page to go to is our af.mil page, the Edwards page, because that's where it would be first posted, and all the other social media platforms would follow. So that is where you can get the latest and most accurate information as far as where our HPCon levels are.
All right, for those, let's see. For those who work on base but are currently on administrative leave and have traveled out of state or country, will they have to quarantine themselves when they come back?
Repeat the question, I'm sorry.
So if somebody's out on administrative leave now, but they've traveled outside of our local area, will they be quarantined upon return? And per the latest wing policy, if you have traveled outside of that area, it is a standard 14 days of quarantine. Then beyond that, though, there are exceptions, and those have to be run through your chain of command. So if there's ways that you can prove that basically there was very minimal risk, you could possibly be allowed back on sooner. But that really is a question for your chain of command. Make sure you're keeping them in the loop.
And I just want to add a little bit to that. So I know there may be situations with our folks that are on admin leave, safety leave, where they're not at work. That is not a time to be traveling unless it's actually necessary. So we're still under that, you're safer at home, so please stay home.
Thank you. Speaking of isolation and quarantine, where are people being isolated and or quarantined?
For that question, I think that is something that with the Colonel Higer's town hall, because there is plans in place as far as how we would isolate versus quarantine if that situation arose. So definitely don't want to get ahead of those plans because they're not finalized yet. But that information, once we get that, we will make sure to share that.
And people are being quarantined or isolated in their homes as of currently. At their residence is the ideal point. They've already been there. They've already been living there and around others that may have been in the same area. To take them to somewhere new could propel the case. So the ideal recommendation is to always isolate at their residence or quarantine at their residence. This one actually, this is a little separate. Do you recommend wiping down groceries after bringing them in the house?
So that's kind of one of those added steps where it's not necessarily necessary, as long as you're just still washing your hands before making food and all that stuff. So you can wipe them down, but again, just like how Major Bates said before, the virus isn't specifically environmentally persistent to a degree that would necessarily warrant you having to wipe down every single thing that comes in your home. So if you really want to, you can. But again, as long as you're practicing that hand washing, you're pretty much good to go. So it's kind of like an above and beyond kind of best practice. And just like how I said in the last town hall, please wash your fruits and vegetables. That's just good practice, period. Not even for COVID. Just keep practicing basically your normal stuff. Same thing with anything coming in your home. If you want to take those extra steps to have it sit outside of it or wipe down or whatnot, that's absolutely fine. But again, it's not necessarily necessary as long as you're following all the other steps, which is washing your hands and all that good stuff. So,
thank you. Can you give guidelines on what to do if you have been self-monitoring at home? Should people call the doctor to tell them if they think they've had it for a phone consultation?
Yeah, so it's always a good step to first start off by calling your doctor. So call the appointment line, call medical. From there, they will generally triage you and then you might get referred to our office depending on what's going on. So for a lot of people, for at least the people that public health is tracking, if you're currently in quarantine, we tend to give them our on-call phone, specifically just for them to tell us, hey, your symptoms changed. They're also encouraged to call their doctor. There's a lot of different modes. No matter which way they go with it, they'll reach either us or they'll reach a doc, and then we'll all have warm handoffs and all that good stuff. But if you've been quarantining and we're not necessarily involved with your case yet, if there's any sort of questions whatsoever, please call your doctor, call the appointment line. That's the belly button essentially for the entire COVID situation. So when you call them, again, you'll be triaged. They'll ask you a bunch of questions. You might talk to a doctor. They'll go through all your stuff, and then they'll either refer you to us afterwards, or it might not be necessary at all. Again, it all depends on the situation, because the situation can be very specific to the individual. But there's a giant net to catch everybody if you just call the appointment line, kind of call it a day.
All right, going back to the questions about kind of sanitizing groceries, washing things down, what about the bottom of our shoes? Should we be concerned about tracking in any kind of virus just with our shoes, with normal foot traffic?
Absolutely, you should probably take your shoes off before going into your house, not just because of the virus. You're more likely to have E. coli and a bunch of other stuff tracking into your house. And that goes for not even COVID situations, so your shoes are pretty much one of the dirtiest parts on your body, and that's something that most people should probably keep in mind when either bringing it into your house. In theory, I guess the virus it's respiratory, so I don't know if you touch your shoes, you should wash your hands after touching them or the bottom of them or whatnot, but it's not really a major concern of you tracking in COVID onto your carpet. It's more so in concern of you tracking everything else you've been stepping in throughout the day onto your carpet, and then maybe kids play on your carpet or something. And shoes tend to be, like I said, some of the dirtiest things you could possibly bring into your home. So taking off your shoes before you enter the house, taking them off right in like a mud room or like before you even get into your house is best practice, period. Unless you're touching your shoes and then touching your face and stuff, I don't think COVID could really, it's not a high transmission for COVID. It is a high transmission for a bunch of other stuff though. So please either wash your shoes, keep your shoes off inside your house, or keep them away, essentially.
Thank you. Back to the question about the local area. We have a question, what is considered local area? And the wing commander has put out guidance for kind of a map. So please get with your chain of command or your sponsor's chain of command to lay eyes on that specific guidance. But the general rule of thumb is where you would commute from on a daily basis. So if you normally live in Santa Clarita and commute each day to Edwards Air Force Base from Santa Clarita, then that would be considered your local area. To go to Las Vegas when you live in Santa Clarita, that would absolutely be outside of the local area. Las Vegas is outside of the local area, period. But just to give an example. All right, and for right now, that is all the questions we have. Is there anything you'd like to readdress for any of our members of the panel?
Well, I just want to thank you again for continuing to help us flatten the curve. We really could not do any of this without you. We are all in this together, and with us being together, we will get through this. This is an adversary that we are facing head on to make sure that we continue to support the warfighter and strengthen our community. Thank you.